New parents rush to the ER constantly for things that are completely normal, and understanding what's actually an emergency versus what's just terrifying but harmless could save you panic, money, and unnecessary trips to the hospital. Let's start with the number one thing that sends new parents into full panic mode: newborn breathing patterns. Your baby breathes fast, then slow, then pauses for what feels like forever, then gasps and starts breathing again. You're convinced something's wrong, but this is called periodic breathing, and it's completely normal in newborns. Babies don't breathe like adults. Their respiratory control isn't fully developed yet. They'll breathe rapidly for a bit, then slow down, sometimes pause for up to 10 seconds, then resume. It looks terrifying, but it's normal, as long as the baby's color stays good and they resume breathing on their own. Here's when breathing actually is an emergency. If your baby turns blue or gray, if they're struggling to breathe with nostrils flaring and chest retracting, if they're making grunting sounds with every breath, or if they stop breathing for more than 20 seconds, but the normal irregular breathing pattern that freaks out every new parent at 2 a.m. That's just how babies breathe. Now let's talk about baby acne and rashes, because new parents are convinced every spot is meningitis. Newborns get acne. They get little white bumps called milia. They get something called erythematoxicum that sounds deadly, but is just a harmless newborn rash. Red blotches with white or yellow centers that look like an allergic reaction. It appears in the first few days of life and disappears on its own. Babies also get heat rash, diaper rash, and dry skin patches that peel. None of these are emergencies. Here's when rashes are actually concerning. If there's a fever with the rash, if the rash looks like bruising or doesn't blanch when you press on it, if it's accompanied by extreme fussiness or lethargy, or if the baby looks sick in addition to having the rash. A rash alone on a happy feeding baby who's otherwise acting normal. Not an emergency. If you're learning what's actually normal versus what needs a doctor, hit subscribe. We're helping new parents tell the difference between panic and real emergencies. Let's talk about spitting up versus vomiting, because parents confuse these constantly. Babies spit up a lot. They have weak lower esophageal sphincters, they swallow air while feeding, and gravity hasn't fully taught them to keep food down yet. Spitting up is effortless. Milk just dribbles out. The baby's happy, gaining weight, not bothered by it. This is normal reflux, and most babies outgrow it by 1 year. Vomiting is different. It's forceful. The baby is projectile vomiting across the room. They're distressed, not feeding well, losing weight, or showing signs of dehydration. Projectile vomiting in the first few weeks could be pyloric stenosis, a narrowing of the stomach outlet that requires surgery. But normal spit up that soaks through burp cloths? That's just babies being babies. Here's something that terrifies parents: baby poop. Newborn poop changes constantly. The first poop is meconium. Black, tarry, looks like motor oil. Then it transitions to greenish brown. Breastfed babies have yellow, seedy, loose stools that look like mustard mixed with cottage cheese. Formula-fed babies have tan or yellow firmer stools. Babies can poop after every feeding or go days without pooping. Both are normal as long as the baby's comfortable. Here's when poop is actually a problem. If there's blood in the stool, if the baby's straining and in pain with hard pellet-like stools, if the poop is white or gray, or if there's no poop at all in the first 24 to 48 hours of life. But green poop? Totally normal. Frequent poops? Normal. No poop for 3 days in a breastfed baby who's otherwise happy? Also normal. Now let's talk about baby noises, because newborns sound like they're dying and they're just sleeping. Babies grunt, snort, squeak, and make all kinds of weird noises. They're loud breathers. They sneeze constantly because their nasal passages are tiny and they're clearing amniotic fluid. They hiccup all the time. They sound congested even when they're not sick because they have small airways. All of this is normal. Here's when noises are concerning: high-pitched continuous crying that won't stop, wheezing or whistling sounds with every breath, grunting with every exhale, especially if they look like they're working hard to breathe, or complete silence. A baby who's not making any sounds and is lethargic is more concerning than a noisy baby. Let's talk about baby eye issues that send parents spiraling. Babies' eyes cross. Their eye coordination isn't developed yet, so one eye might wander while the other looks straight. This is normal up to about 4 months. Babies also get clogged tear ducts. One eye waters constantly, gets crusty, but isn't red or swollen. This usually resolves on its own. Here's when eyes are actually a problem. If there's thick yellow or green discharge with redness and swelling, if the white of the eye is red, if the baby is extremely sensitive to light, or if you notice a white reflection in the pupil, but crossed eyes or watery eyes in a newborn, usually not an emergency. Now here's something that makes parents lose their minds: soft spots. Your baby's skull has fontanelles, soft spots where the skull bones haven't fused yet. You can see the soft spot pulsing with the baby's heartbeat. Parents are terrified to touch it, but it's covered by thick membrane. You're not going to hurt your baby by washing their hair or gently touching the soft spot. Here's when the soft spot is concerning: if it's sunken in, which indicates dehydration, or if it's bulging and tense when the baby is calm, which could indicate increased pressure in the skull. But a normal, slightly pulsating soft spot? That's just how baby skulls work. If this is calming your new parent panic, make sure you're subscribed. We're breaking down what's normal so you can recognize what's actually an emergency. Let's talk about baby temperatures and fever. A baby's normal temperature can range from 97 degrees Fahrenheit to 100.4 degrees Fahrenheit, depending on how you measure it and what the baby's been doing. If your baby feels warm after being bundled up, that doesn't mean fever. Here's the actual rule. In babies under 3 months, a rectal temperature of 100.4 degrees Fahrenheit or higher is an emergency. You go to the ER immediately because newborns can have serious infections without obvious symptoms. For babies older than 3 months, fever alone isn't always an emergency if the baby is feeding and acting relatively normal. But newborn fever, that's always urgent. Now let's talk about cradle cap, because parents think it's a skin infection. It's just baby dandruff, thick, yellowish, crusty patches on the scalp. It looks gross but doesn't hurt the baby. You can treat it with baby oil and a soft brush. It's not infected unless it's red, weeping, or the baby has a fever. Here's something parents rush to the ER for: tongue tie and lip tie. The baby has a tight frenulum under the tongue or upper lip. Parents discover it and panic. But tongue tie only matters if it's affecting feeding, if the baby can't latch properly, isn't gaining weight, or you're in pain while nursing. If feeding is going fine, tongue tie doesn't need immediate intervention. Let's talk about baby sleep patterns. Newborns don't sleep like adults. They have short sleep cycles, they wake frequently, they're noisy sleepers, they twitch and jerk in their sleep, and sometimes they sleep with their eyes partially open. All of this is normal. What's not normal is a baby who's impossible to wake, who's lethargic when awake, or who's sleeping excessively and not feeding. Here's something that terrifies parents: baby startle reflex. Your baby suddenly throws their arms out, arches their back, looks panicked, then calms down. This is the Moro reflex, and it's a normal newborn reflex that disappears around 4 to 6 months. It gets triggered by sudden movements, loud noises, or the sensation of falling. It's not a seizure, it's just a reflex. Now let's talk about when you actually do need to go to the ER with a newborn. Fever in a baby under 3 months, difficulty breathing, not feeding, or keeping anything down for multiple feedings. Fewer than 6 wet diapers in 24 hours indicating dehydration, lethargy, or extreme fussiness that won't resolve. Blue or gray color, especially around the lips, or a soft spot that's either very sunken or very bulging. Here's what pediatricians wish new parents understood. Babies are weird. They make strange noises, have weird poop, develop random rashes, breathe irregularly, and generally look like something's wrong when they're perfectly fine. Most things that terrify new parents are completely normal variations, but because you can't always tell the difference, pediatricians would rather you call with questions than sit at home worried. Here's the truth. New parent panic is real and understandable. You've got this tiny human you're responsible for keeping alive, and every little thing feels like a potential catastrophe. But most of what seems like an emergency is just normal baby weirdness. Learning the difference between call the pediatrician tomorrow and go to the ER now saves everyone stress, time, and money. Next time your baby does something that makes your heart stop, take a breath. Check if the baby looks comfortable and is feeding normally. And if they are, it's probably just another weird normal thing that babies do. And if you're not sure, that's what your pediatrician is for. Call them